together with a COVID ICU caseload of 177 today. There are more than 550 people presently in intensive care beds in New South Wales. The forecast by the New South Wales Government in modelling released today by the Premier Gladys Berejiklian is that number will grow to 947 in early November, or over capacity, with 560 of those patients being COVID patients. Then, despite the fact the Premier says that she will start to open up in October, the caseload supposedly comes down. That is because, the argument goes, even though you are lifting lockdown, you are increasing the number of double vaccinated people to the extent ICU hospitalisations decrease. Berejiklian arguing the disease won't spread so much in opening up because people attending venues will be double vaccinated.
I wanted to one thing, sorry, I just didn't quite get an answer on that one, which was, is this based on New South Wales still being closed, so pubs and clubs and restaurants and things being closed, or does it take into account the fact that we are going to open up, so that on the 1st of November we are going to have some things open?
Yeah, but obviously when we do open up at 70% double dose, anyone who interacts with each other will be completely vaccinated, so that massively reduces the chance of anybody requiring hospitalisation.
Even at the end of November, the modelling predicts 842 people still in ICU. Right now, before they move to surge capacity, the Australian and New Zealand Intensive Care Society has said New South Wales has 845 fully staffed private and public hospital ICU beds. Berejiklian said today there was a surge capacity to get the number of ICU beds to 1,550. Already we know several other wards at several hospitals are being converted.
We have 177 patients in our intensive care units with COVID. At any given time in our hospital system, there'd be around 400 people with non-COVID related issues in ICU. And so our surge capacity, including staff, in our intensive care units is 1,550. We're likely to reach a peak in cases in the next week or so. That's what the modelling tells us.
New South Wales Health Deputy Secretary Susan Pearce giving the guarantee today that anyone who needs ICU care will get it, and says in worst case scenario planning, field hospitals were considered, but her view is they will not be necessary.
My message is to reassure the community that anyone who requires ICU care during this period will get it. I know we've spoken about theatres and recovery wards. Are we also looking at field hospitals, or are we just looking at the hospitals that we've got and using the spaces we've got in there?
Look, field hospitals were put in as part of a planning exercise. At this stage, we are not anticipating field hospitals.
But what about the AMBOs? They are pulling massive shifts already and ramping at hospitals for hours. Will they have to look at the protocols for when people are taken to hospital by ambulance with COVID, or what other resources can be put into this space? Kerry Chant, the New South Wales Chief Health Officer, saying with the Pfizer now coming from the feds, the chance is there for more and more to get vaccinated. That can change what she calls a scary trajectory in the modelling. 73% of people in New South Wales have had their first dose. Chance says she wants that to be 80% by the end of the week, and that's an important indicator because it shows 80% of people will get double vaccinated.
We have seen the scary trajectory and been reassured about the hard work that our intensive care and our staff are doing to prepare for this. But we can change that trajectory. You know, vaccines take 2 weeks to work, and 2 are better than 1. So can we just have this as the week that we get vaccinated? And that will then mean that the lot of our intensive care colleagues, our ED colleagues, our ambulance and paramedic staff will be a little bit better.
And I ask again, Kieran, exactly how much can be opened up at 70% double dose vaccination by the Premier, as opposed to 80%, which would probably be reached 3 to 4 weeks later? We'll know the answer to that in about a month's time.